Welcome back to Why We Nurse. I'm your host, Serena Tobar, and today's guest is truly mission driven, multi talented. I'm honored to introduce Dr. Carly Dillard, DNP, a clinical assistant professor at Baylor University, American Nurses Association mentor, and CEO of her own consulting firm. She's also the host of Pink Table Talk and serves on the board of Beyond Pink Foundation. Today, we'll explore how earning her doctorate has opened up so many doors from academia to advocacy, and how she's amplifying nurses' voices through podcasting, mentorship, and board leadership. Let's dive in. Dr. Dillard, welcome.
Thank you so much, Serena. It's a pleasure being here with you tonight.
We're excited to have you. So let's get started with your journey. What inspired you to pursue your DNP, and how did that decision to guide your career path?
So I've always wanted to pursue higher education since I was a young child. But I really have to say the most pivotal moment for me was during my first year as a new grad nurse. During that year, when I was in my orientation at Johns Hopkins Hospital, working in the neuroscience floor, the preceptor that they assigned me to, she was very rough. There's a saying in nursing that says nurses eat their young. And so for me, going through those 12 weeks with such a harsh, very strict nursing preceptor, it let me see that we need better leadership, so that we can nurture our nurses and cultivate them using compassion. I feel that a lot of the old school way thinking in nursing was to be very harsh, to be very strict, to be very kind of mean. And so for me, I wanted to cultivate a different way to bring up the future nurses. And so for me, I've been very passionate about leading nurses in a compassionate way. We don't have to be so strict on them, so harsh, so mean. We should be enforcing policies, making sure that they're safe with patient care, but we can do it in a much more empathetic way. So for me, I've always been on this journey of pursuing leadership. So I would take, maybe charge nurse roles. I would always precept other nurses. I always took the initiative to try to fit my way into leadership. And so when I heard about the DNP programs, I said, aha, this is what I need to pursue. This way, it will equip me and prepare me to be an excellent leader in nursing.
I totally agree. I think that really that first, what's the word I'm looking for? Introduction into nursing, right? With that preceptor, it can make or break a nurse. It can make a nurse say, I can't do this anymore. Or it can really jumpstart a nurse. And compassion is very important. It's a foundational aspect of nursing. And I'm learning more and more about compassion and caring. And I've been really digging into Jean Watson's theories. And
Yeah.
I'm actually currently doing, it's a little mini class that she has. And it's about, I think, 8 weeks or something like that, 4 or 8 weeks. And it's a little mini class through her Caring Institute that really kind of goes over caring in the digital world.
Yeah.
It's very thought provoking because it makes you think. Since we do so much digitally, how can we still care? But I'm very excited that you're here and that we're able to talk about these advanced degrees, and especially the DMP, because of the current climate and what is considered a professional degree and what is not considered a professional degree.
Yes, absolutely. I know currently right now they've deemed nursing not professional. And to me, it's very disheartening. I feel that nurses, we have been professional in the healthcare careers for a very long time. We are in fact nurse scientists. Oftentimes we're demoted or degraded into being the doctor's handmaiden. However, we are not. Nursing is its own specialty in itself, and we treat the symptoms of a patient, not just their medical diagnosis. And without nursing care combined with medical care, patients would not get better. They would not be able to be discharged from the hospital. And so for me to see them trying to remove nursing as a profession so people can pursue those higher degrees is very, very disappointing and discouraging. I feel that we need to really advocate right now to ensure that nurses can go on to achieve those advanced degrees such as becoming nurse practitioners, CRNAs, doctorate prepared so they can teach. It's very much needed in this time and day so we can continue to advance the practice and raise up future generation of nurses.
Yes, totally agree. So, during your DNP program, was there a particular moment or a project that you did that really solidified your passion for leadership and education?
Yes. As I was finishing up my didactic courses and starting to head into the capstone portion of my doctorate, COVID-19 pandemic happened. And so when this happened, it let me see all of those gaps in practice that we had not addressed. It showed us all the areas of weakness that we needed to improve in healthcare and in public policy to protect the health of not only our nation, but of the world. And so for me, seeing that crisis, it really strengthened my belief in pursuing the doctorate so that I could be a leader at the forefront to help push policy, to help make sure that we have the right practices that are evidence based and scientifically backed to prevent more pandemics down the road.
Excellent. Excellent. So, let's talk about your role as a clinical professor. How does your DNP background inform your teaching, especially with your clinical rotations?
Yes. Well, it has made me an expert in the field. I have to say that not only my 16 years of experience in nursing has shaped my background, but also the doctorate. Those 4 years that I spent, because I did a combined master's and doctorate program, it really helped me to search through the literature. I read about all sorts of issues in nursing, from staffing to protection, personal protective equipment, infection control. We studied the nursing theorists, like you mentioned, Gene Watson. It really prepared me to be able to teach the next generation of nurses. And so now I'm able to assess students. I can tell on the first day, what are their needs going to be? And so I can teach them in a way that actually makes an impact in their life. And then I always question them. I'm asking them, what's this medication? What is the side effects? What is it related to? And they're like, oh, how did you know everything? Sometimes I feel like a walking textbook. They're like, how did you know the patient had that? I said, because I know the diagnosis. You start talking to me about the patient, I already can know what their background, their symptomology, everything. And so I'm grateful and thankful for that education.
Yes. And lots of practice. I also teach clinically. And so when I'm asking my students the same questions, well, why are you giving this medication? And what side effects should you be looking for? What labs should we be looking at? What assessments should we be doing? And how do you how do you know these things? How do you know to ask us that? It's like I've been giving these medications for years. And so years and years and years of the same medications over and over, and teaching my patients, because every time I give a medication, I teach the patient. So if they get a medication 4 times a day, they're getting teaching on it 4 times a day.
Yes. Yes.
And that helps with their overall compliance, because a lot of times we say patients are non-compliant. It's not really that they're non-compliant, it's that they're lacking something. They're lacking the education, the understanding. There's just something lacking there, maybe financially or something. And so if we give them as much tools as we possibly can, they're going to be able to take better care of themselves when they go home.
Yes, absolutely. So, one of the main things that I teach and that I push my students to encourage their patients with is health literacy. So, health literacy is the patients actually knowing what their medications are for and how to properly take it. And a lot of patients don't know that. A medication may read once a day, but what time of day is best? And we need to be able to assess, do they actually understand this? And so I always encourage my students to ask open ended questions to their patients, such as, what is your understanding of how to take this medicine? And you'll quite often find that they don't know. I remember there was a patient years ago. He went through the ER because he had been prescribed vitamin D, and it's like 50,000 units. And so it's supposed to be once a week. and he was taking it every day.
No.
And so even though nothing was wrong because it was just a vitamin, imagine if it had been something more potent, you
Right.
know? And so that's when it kind of clicked for me. It's like, it's not them taking it. So compliance is them taking it, but it's about the knowledge of when and
Mhm.
how to take it is the issue.
Right. And sometimes, like you said, it says once a day, but they think, okay, well, today I can take it at breakfast. Oh, I got some things to do. So I might take it at dinner later, especially like Lasix. Oh my
Yes.
gosh. I have patients all the time that, well, I had a lot to do today. So I just didn't take my Lasix today. I'll take it when I get home.
Yes, they don't want all that to have to go to the bathroom all day. And so I totally understand that. I know patients, they won't take their diuretic if they're on a road trip.
Yeah.
They will.
And that's absolutely not the right thing to do. But if they continue to take it every day like they're supposed to and follow all of the other instructions, they won't have as much urination because
Yes.
they won't have all the extra fluid. So
Yes.
that's the other thing we have to teach them.
Yes. And when to call their doctor. For
Right.
instance, if they are going on a trip, maybe the doctor can say, well, take half a pill in the morning, half the other half in the evening when you're off the road. It's important to know when to call your doctor and to seek their advice. And that's also that health literacy.
What do you feel your role as a doctorally prepared nurse brings to your students and the nursing profession just in general?
Think it brings a lot of respect. I think it also brings confidence in my abilities. I feel that being a doctorally prepared nurse, people feel confident in my education and experience. They feel that this is somebody who really has studied and not only studied, but applied evidence based practice, through my capstone project. And she really knows what she's talking about. I feel that it does distinguish us amongst other, maybe MSN or BSN prepared nurses because we went one step further. We actually apply the evidence and the literature to the practice. And so for me, I feel that it gives us just that little bit of an advantage above other academically prepared nurses.
So let's talk about your podcast. You host Pink Table Talk, and this is a podcast that uplifts conversations on wellness and empowerment. What inspired you to start this podcast, and how does it align with your nursing mission?
Yes. So the podcast kind of just fell into my hands. I was working at a hospital as an educator, and I kept bumping into this nurse practitioner. We always would just kind of say hi and exchange words. And then I was invited to a Life Surge conference in January of 2024. And so this conference was about, empowering us to start our own, businesses or to go out on a limb and, to do those things that we have been dreaming about. So after that conference, I joined their Facebook group and I saw MJ post in that group about doing speaking engagements and doing the podcast. And so when I saw her in the hospital, I said, Jay, we were at the same Life Surge conference. And she said, oh, yes, it was great. And we just started talking, and she invited me onto her podcast for Women's History Month in March. And on her podcast, Bold Why Not, I talked about myself, my career, and they absolutely loved it. The whole audience loved it, and they all wanted me to come back. And from there, they pitched to me, do you want your own show? And so I said, yes, I've been actually thinking about a show now for the past year. And so I pitched to them the idea. They loved it. And so it just went from there. And I absolutely love doing it. It's so much fun and it's so inspiring, not only to others, but to myself as well.
I love it. I know you have invited me to be a guest a couple of times, and it's been some really good conversations that we have had. It's kind of funny. My podcast didn't fall into my hands, but it was something that I really started considering after doing some research for an organization that I'm in. And we were looking at how we can use different technologies in nursing professional development. And so podcasting was one of the technologies. And it just so happened I was like, I think maybe right after we had started kind of doing that, you had invited me on your podcast, and I had had some conversations with somebody who I was on a board of directors in TNA with, and she had her own podcast. And so I thought it was just a good time to kind of start researching what does it take to do a podcast? What would my podcast even be about? Right. So that's the first thing. Like, what are you going to talk about? Just that I stewed on that for a little bit and kind of came to this because there's a lot of negative things about nursing, and there's a lot of podcasts out there that, they're funny. They tell funny stories from nursing, and it's kind of a way to vent out because nursing can be very, very heavy at times. And so not to take away from, those that are funny, and I enjoy some of those podcasts too because I can relate to it.
Yes. Well, stories.
Yes, you can relate to and some of the stereotypical kind of things that happen to nurses. So you can kind of relate to that a little bit. But at the same time, I was like, I just don't want nursing to always be seen in a negative light and that like nurses are so unhappy because we're not. We're not unhappy in our careers. We do this for a long time. I've been doing this for 25 years now. I know you've been doing this for a very long time. I have colleagues that have been doing this for 30, 40, 50 years. And so I wanted to bring some of that to light because I feel like we don't talk about that enough about
Yes.
why we continue to show up day after day.
Yes, absolutely. And I love this concept for your podcast. I think it's so important why we nurse. I think it rings so true. And when a person can talk about why they're in this profession, because you truly have to have a passion for it. You can't go into nursing just wanting, a stable career with money because you'll leave faster than you came in.
Oh, yeah, for sure. It's heavy. There are days that are
It's
very,
heavy.
very heavy
It's heavy.
emotionally. There are days that are very, very heavy physically. But
Yes.
the relationships that you build, there's a lot of trauma bonding.
It's true, but it's so giving too.
Yes.
Not only do we give to others, but I feel that I've been fed through this career as well. I feel that it has enriched my life in more ways than I can even imagine it and even tell. I feel that I was born to be a nurse. I feel there's no other career out there for me. And I'm going to live, breathe, and die a nurse. I mean, at some point we retire, but I think I'm still going to be nursing in some capacity.
Same, same. I'm still gonna be doing something with nursing up until lunch on the day of my funeral, so it's okay.
Yes, yes.
So, from your podcast, what have been some of the most meaningful conversations or takeaways that you've had?
Yes. So I feature oftentimes a lot of women who have been through trauma. We talked about recently just about how nursing can be heavy. I feel that it equips us to listen and be able to have that empathy for when people share their traumatic stories. So for me, one of the most impactful stories is about a young mother who I've been helping through an organization I'm a part of, Safe Families for Children. She was recently on my show just a couple weeks ago, but she's an author and a poet whose daughter was kidnapped by the father. And so she's been through back and forth with court and other legal issues trying to get her daughter back. At one point, she had her daughter back, and the father was in jail. And then he got released from jail and then kidnapped the child again. And
God.
so for me, seeing her strength through this very big tragic moment in her life, she's still writing, she's still giving speeches while holding strong, still fighting and searching for her child. It just is so touching to me. I just, her strength gives me strength. And just knowing her story and being able to share it lets me know that podcasting and giving people that voice, it's so important.
Yeah. Yeah, giving somebody a voice to let their story be heard because there's probably somebody else out there who's having the same situation. Maybe it's not an ex-husband or the child, maybe it's not the child's father. Maybe it's, a grandparent
Yes.
or a cousin. It could be anybody, but there are people out there who are suffering the same thing and they hear this story and they're like, oh my God, there's somebody who can understand what I'm going through. And maybe they can share resources.
Yes, absolutely. And she had shared a resource on my podcast most recently, and it's a organization that helps other mothers going through similar situations. And for me, I didn't know mothers even went through this. We often hear about fathers being estranged from their children through the custody issues or moms disappearing with the kids. But we don't hear a lot about mothers not having their children due to those issues. And so to me, that is just, it's unimaginable. It's
Exactly.
unimaginable. Yeah.
So you also serve on the board of the Beyond Pink Foundation. Can you tell us a little bit about your work there and why it resonates with you?
Yes, absolutely. So part of growing in leadership within nursing, I know that being on a board is one of those kind of stepping stones to continue help developing my role as a leader. So through one of the organizations that I'm with, they're trying to empower nurses to join boards. So I saw Beyond Pink Foundation for Breast Cancer. I said, well, my favorite color is pink. I have pink tabletop. I said, well, I need to join this foundation. I have to. And so, I went through the process. It was a rigorous process. It was about 4 interviews and, sending in videos and answering questionnaires. And so, what it meant a lot to me because it's a foundation that supports women. And that is one of my huge passions in this lifetime and in my career is supporting women. And so these are women who have either they're going through breast cancer, they're survivors of breast cancer, or they may know family members who have breast cancer. And so serving on this board, we are giving them a voice. We're supporting them through community efforts. We just created a student scholarship program that is launching in January to help students go to school. Maybe they want to pursue a career in nursing or other healthcare fields. And so we want to support that. Also, they have a podcast called Thriving Podcast. And so these are stories of survivors thriving beyond after their cancer diagnosis and treatment. And so I love being a part of this wonderful board of women. We feel so empowered. We're doing so much for the communities and we want to continue to grow. And it's just such a beautiful thing to be a part of.
So, how does your clinical, academic, and podcasting experience influence your advocacy and your board leadership?
I feel that it strengthens me. I feel that it puts me in the right position to be able to make an impact. I take all of that with me, my experience, my education, and I'm able to apply it, come up with new ideas, innovations. I'm able to help create suggestions so that we can make a community impact. What is it worth if all we do is work and get our education just to make money? I feel to me that my career, my education is so that I can leave a lasting legacy in this world. And even for my children, they love the work that I do. They know everything that I do, and they even tell their little friends, and it makes me laugh. They're like, my mom has a TV show. My mom does this. She's a doctor. And so I know with all of these things that I'm doing, it's not for myself but it's for the world. And I truly want to impact the world and leave behind a lasting legacy.
Yes. And your children are seeing this and they're learning how to give back and how to support their communities and how to provide themselves what they have, their talents and their intelligence and their qualities that they can use to impact their communities as they grow up.
Yes. They saw one time we were driving by and they saw a homeless man on the street. And they told me, Mom, maybe we can put together a bag for him with some soap, some, lotion, some food, some little things for him. And to me, for them to be so young to start thinking about others in that way, it really touched my heart. It really did. And so I told them, I said, yes, we will do that. We will get some things together and we will hand out some bags to the unhoused people in this Houston area. And so to me, just my children, now they're giving me ideas on how to impact the community.
That's so wonderful. How has earning your DMP opened doors for you?
Yes, at first, it's so funny. One of my classmates and I, towards the end of any degree, we all started getting that feeling of like, why are we in this? What are we doing this for? And so for me, when I did finish the program, I was kind of thinking like, oh boy, what's next? Is this going to actually help? Did this really make an impact? And so what I have seen in the past almost 4 years now that I've earned my doctorate, it has opened doors. There's been more job opportunities. I was actually recruited to come to Houston from New York because of the doctoral degree, and they paid for like my relocation and things like that. Also, it's opened the door for me to be able to teach. And so I love teaching. I love building curriculums. I love being able to do speaking engagements, write. I wrote some articles. And I want to continue to do those things. I feel that having the doctorate degree, it really does open doors for us in such an impactful way. People will see that you have the education, so they have that trust in you. They know that you know your stuff. And so, it does help.
What advice would you give nurses who are considering a doctoral degree?
Be prepared for long hours of studying, lots and lots of reading. Truly sit with yourself to be committed to the process. Going through the doctorate program was not easy by any means. It's quite challenging. It will make you really think about yourself, about your life. And there are moments when you're going to want to give up. But I say, keep going. Take your time, even if it takes 5, 6, 7 years, take your time, trust the process because it's going to refine you. And it truly does. It purifies you. It makes you stronger and better to handle the nursing state as it is now.
I agree. I agree. As I've been going through my own doctoral journey, it is definitely, you have to schedule yourself time to read and write because it's a lot of writing. It's a lot of research. It's a lot of organization. And so if you are not somebody who is a self starter, um, then it can be rather difficult to get through. And so I have found that I have to like sit there, put on my calendar, work on literature review, work on chapter 1. And I actually had to schedule myself just a whole like 8-hour day where I did nothing else but write. And I was able to get through my first rough draft of my chapter 1 of my dissertation in that 8 hours. But I mean, I literally like nothing else, like no other things going on. And so
Yes.
I had to do that.
Absolutely. One other thing I would also tell nurses or anybody ready to pursue a doctorate, be prepared for rejection. Going through that process to have your paper and your ideas, it's going to go through quite a lot of revisions. Well, I think I had 6 or 7 different ideas that I handed to my before I got an idea that was approved. And then once I started my capstone, it started out one way, then it was tweaked and tweaked and tweaked. And then with the paper, the final paper, I think there was 9 different versions, and some people, they can't handle that rejection. They get that one mark, oh, change this line, and they break down.
Mhm.
You have to be able to handle that and to be humble yourself to accept whatever the change they recommend. It might be put this comma over here or change the title of your sentence of your paragraph. And you have to accept it and trust the process, like I said, and go through
What
it.
skills or mindset prepared you the most for thriving as a doctorally prepared nurse?
I would say my life experiences. I've been through a lot of traumatic experiences in my life. Even going through the doctoral program, I started out with a 4-month-old, and I'm up breastfeeding and writing. And halfway through the program, I had baby number 2. And at one point, I had 2 kids under 2, working multiple jobs, doing a doctorate. I feel that just those life experiences truly strengthened me and prepared me to handle everything that has come with accepting the degree and the role of being a DNP. It's different. And there's a lot more challenges that do come once you obtain this degree. There's a lot more judgment, there's a lot more expectation, and so those times, those moments going through it really helped prepare me to handle it.
Well, thank you so much, Dr. Dillard, for being with us today.
You are so welcome anytime, Serena. And I'm so happy to be able to have shared this time with you today.
Dr. Dillard's journey reminds us that a doctorate isn't just a title, it's a platform to teach, to advocate, and to inspire. From pink table talk to leadership, her work shows how one nurse can influence academia, healthcare, and community wellness all at once. And that's exactly why we nurse. Thank you, Dr. Dillard, for sharing your insights and leadership with us today. If Dr. Dillard's story sparked ideas or questions, please share them with your nursing community. Comments are always welcome. Follow at Why We Nurse on Instagram for more inspiring stories and behind the scenes content. Have a story to share or want to be a guest? Email me at whywenursepodcast@gmail.com. Until next time, stay bold, stay compassionate, and remember why you nurse.